Namaskar and a very warm welcome to this edition of our live program, Let's Talk Health. I'm Nidhi Kumar and you're watching India Science. As COVID 19 continues to surge across the globe, COVID related queries are also on the go. People are speculating about health problems. In this program, where we take your questions from Facebook and YouTube Live, today we're joined by the very well known Dr. Siddha Chakra Rao, Chairman Resuscitation Council Federation. Many thanks for joining us, Dr. Chakra, and welcome to India Science.
Thank you very much for inviting us.
Yes,
Thank you.
our pleasure. What are some advices that you would give for the cardiac patients before we begin the program on CPR, which is very, very essential today? Tell us some advice that you would like to give to cardiac patients during these new variants, and as we are continuously seeing a surge not only in India but also in many global uh, parts of the world. So,
Actually, cardiopulmonary resuscitation is an entirely a different subject. Especially, this is a very sudden onset. Usually, that happens because of the irregularity in the rhythm of the heart, maybe due to myocardial infarction, or maybe due to some drug abuse or something like that. And sometimes the victim will be almost all right without any disease, but he will be showing a sudden cardiac arrest. What happens is, especially in the COVID era or post COVID era, it is found that there is a clotting of the clotting of the blood in the blood vessels of the heart and even in the lungs. So the main pathology seems to be in the clotting of the blood. So if it happens in the heart, it leads to a heart attack, and sometimes it may be leading to a sudden cardiac arrest. Or if it happens in the lung, definitely the lung will be damaged because of the ischemia, like a pulmonary shows the signs of a pulmonary embolism, and their oxygenation cannot be achieved completely. So it is this the percentage of the victims of cardiac arrest and the heart attacks have increased day and day out after the COVID-19. So we are seeing many patients, and these patients actually, to tell you frankly, this sudden cardiac arrest is can happen to anybody, anywhere, without any age restriction, or whether he is rich or poor, young or old, or with disease or without disease, or male or female.
right.
How it happens? How it happens? We will not be knowing, but the main cause of this sudden cardiac arrest is the irregularity of the heart. So, in this irregularity of the heart will not be able to pump adequate blood to the brain. So, the blood is carrying the oxygen, and there will be a lack of oxygen supply to the brain, and suddenly the victim collapses. So, this is the sudden cardiac arrest.
Right.
So, this
Doctor, let me just interrupt you here. Please explain the difference also between a sudden cardiac arrest and a heart attack before we go on to other important questions. For a
says,
layman.
yes, right. A sudden cardiac arrest, actually the victim collapses immediately without anything, he collapses because there is no blood supply to the brain. In a heart attack, it is the shortage of blood supply to the heart itself because of the blockage of the blood vessel. So here he will be complaining of some chest pain or dyspnea, and he will tell the people around him that he is having something, and he will ask you to take him to the hospital. But in the sudden cardiac arrest, there is no time left he suddenly collapses. So we have to attend on him immediately. So if you attend immediately, even 1 minute delay will actually decreases the chances of survival by 7 to 10%. So we have to attend immediately. There is no golden hour here. It is only the golden seconds and golden minutes. So we should be very careful, and everybody should be trained and should be ready.
Yes, doctor.
And,
You
and
are the
another,
chairman. Sorry. You are the chairman of the Indian Resuscitation Council Federation. What exactly is this federation? When was it formed and what does it do, sir?
actually, there was a survey by Labrat in 2016 saying that about 98% of the people in India do not know about CPR. Then the Indian Society of Anesthesiologists have asked me, and because I was the past president of the Indian Society of Anesthesiologists, why don't we start our own Indian guidelines? Because there is no awareness. People are succumbed to the cardiac arrest, and out of the people that are succumbed to the cardiac arrest, uh, 90% of people are dying because we do not know what to do. And we have a lot of languages, religions, and different superstitions, and so on. In this, actually, 4,280 people per 1 lakh population per year are getting sudden cardiac arrest. And out of these, about 80% of the people are getting cardiac arrest outside the hospital only. And because most of the people will be outside the hospital, and 70% of these victims are getting cardiac arrest at home. So, what we advise is there should be not only your learning CPR, you should teach CPR to your family members, your neighbors, your children, and the place of your work. So, this is most important aspect of teaching CPR, and we have come out with a slogan: every citizen a lifesaver. So actually, we have the ambition to train even the 140 crore people as the lifesavers, and it has to be done. In the meanwhile, what has happened is it was actually been observed, our activities has been observed by the American Heart Association and the International Liaison Committee of Resuscitation. So one of the past president has came to India and called me. So we about 10 people went to met him at Bangalore once, Hyderabad once, and twice in uh, uh, Delhi, especially in All India Institute, including our chief of the cardiology of the All India Institute, Dr. Nitish Naik, also has joined us because he wanted to encourage us because we have come out and this has to go on, he knows. So then he said, it is not only you anesthetists, there are many specialty of doctors who are involved in this, like even pediatricians, emergency medicine physicians, critical care physicians, cardiologists, and even the surgeons, the trauma specialists, he said. Then we have also added the nursing faculty and the technicians so that they can take care in the pre-hospital care. See, most of the doctors are taking care only in the when the victim comes to the hospital. But there should be a lot of role of either a doctor or a person or a layman or a student or a paramedic to take care in the pre-hospital care. So before he comes to the hospital, the victim should be taken care of. This is most important. Otherwise, don't lose time. Don't wait for an ambulance. It is very difficult nowadays in the cities. there is no ethics of giving passes to the ambulance and all. It is taking a lot of time. And so, what we have to do is we have to immediately restore the blood supply to the brain. That is the main motto of doing a CPR. And don't bother about anything. So, if you find a victim fallen in front of you or already fallen on the ground, you make a big hue and cry, call for help, talk biggerly. If there is anybody, even is a layman, that help is also needed. And call for, you just try to observe him and tap him on the shoulders, sitting in front of him, talking into his regional language, and talk to him. Hello, hello, how are you? What is your name? How are you doing? If he is responding, it is all right, and you can turn it to the left lateral position or a recovery position and observe him till the ambulance comes. You have to observe him every 2 minutes. If he has not responded, immediately you call for 108 or 112, which is the Indian numbers. So there you open up your mobile, open your speaker phone, so that he will be telling and you will be knowing what you are telling. You identify yourself, you identify the place with a landmark where you are doing there, and you tell them what is the cause of this problem, where is the victim, and all, and ask them how many people are affected. Suppose it may be an electrocution, it may be a, a leakage of poisonous gas from an industry, or it may be a drowning, it may be a road accident. Anything may cause the cardiac arrest and a fall of an unconscious individual. So, in this, you tell him and ask them to bring an AED. So, this is our conveying the thing. And don't close your phone till they say yes and everything is clear to them. Of course, they can be identify you and locate you on the GPS, but you should be careful when you are conveying your message and see that they know they are listen to you properly. And then what you have to do is you have to, of course, I told you, when you have met with a person in different conditions, if there is an electrocution or a poisonous gas, shift him immediately to a safer place. Otherwise, you also will be involved and both of you will be the victims. So, shift him to a safer place and start CPR. So, what is CPR? So, immediately you start the chest compression. Why do you do chest compression? Because there is no flow of blood to the brain. You have to compress the chest almost in the middle of the chest, so that the heart will be compressed between the sternum and the vertebral column behind, and the blood will be pumped into the coronary arteries and to the brain, and the supply to the oxygen supply to the brain is restored. In so doing, definitely don't take any time. And how do you compress? How do you compress means you identify the gyphoid sternum, the lowest part of the rib cage, and take 2 inches depth breath and make your palm of the hand or heel of the hand and keep it on the place and interlock with the other hand and compress on the chest with the heel of the hand. Come close to the victim, sit or stand on your knees, and then transform the whole of your weight without any um, angulation at the elbow or anything. The only movement that occurs is at the hip, and you will be compressing. So, how many times you have to compress? That I am talking about the quality CPR. This quality CPR is most important, and it is very important because the quality CPR will definitely make the victim return to the consciousness. What is quality CPR?
Absolutely. Yes, doctor. Before we come to quality CPR, and I have a few more questions on CPR coming my way. The two questions which have just come to us, if you permit, I'll take them. Mr. Manoj Varghese from Science Communicator, he's asking, Dr. Rao, is there a difference? What is the major difference, and how can you really spot the difference between brain stroke and a heart attack? If you're a layman, like you said, every citizen a lifesaver, how do you get to know what exactly has happened to the patient if you're a bystander?
Yes, bystander definitely. The when the brain stroke or a stroke, actually we have to ask them to clench the teeth. There will be deviation, and there will be slurring of the speech, and we can ask them to make your hand and give a grip test, and there will be sometimes the deviation of the mouth and even the eyes. So this is one of the important thing. And nowadays, when the stroke, if you attend them immediately and give them the antithrombotic injection, definitely the 100% recovery of the brain cells will be there. So this is a very important question, and one that has to be observed. Right. Thank you.
So, for that injection, you need to take the patient to the hospital as well.
Yes, yes. So what we
Absolutely.
tell is all these maneuvers cannot be done in all the hospitals. They are
Right.
very exclusively tertiary care hospitals can do. And if there is any other problem, there may be a problem for the victim also. So there are special hospitals which will take care of this brain. There we have to take. But what we advise you is take the victim as early as possible to the nearest medical facility so that those people will assess and direct you where to go.
Another question that he's asking is that is a headache or a pain behind the eyes, above the ear, the right side, any indication of a brain or a heart problem, if that is what the patient is telling?
So, pain behind the ears or eyes are definitely sometimes may be caused by something in the brain, but not all the times. So, definitely, when we are thinking of the worst situation as a bystander, we will not be knowing what is the previous condition of the victim, and the victim will not be moving with all these health records. So we always think in the worst way and try to resuscitate them. To you, when you don't know it, you try to think it as a devil. Then only we can save the victim.
Right, doctor. What is the success rate of CPR in India at present, and how do you propose to make every citizen a lifesaver? And train people in India for CPR. What is the method to do this?
Actually, as I told you already, 98% of the people in India do not know CPR in India. So, how can we assess the success rate? Actually, we have started a survey recently for the last 3 months. Only about 10,000 people have answered that survey. That is a survey come awareness program we have started, and we are assessing the success of CPR. Nowadays, with our propaganda and all those things, lot of news are coming in the papers that somebody is affected in an aeroplane, some lady doctor has resuscitated, and so many newses are coming, and definitely it is all adding to the creating of awareness, and we feel proud of that. Actually, what we are telling is, you take the photograph of that person and make him to say that I am survived by CPR. That photo I wanted to take it and project it to the European Resuscitation Council. The European Resuscitation Council is backing us a lot, and they want us and to encourage. These are all the things. And another thing is, in America, the success rate is about 46%. The best city is Seattle, that is in US. There, I think 100% of the people know about CPR, and they have a community AED. I will talk to you about the community AED. So then there the success rate is about 67%. So that is one of the things, and probably if we are trying to achieve it, and probably it may take little time because of our attitude towards the disease and all. Oh, it's already gone and all, people leaving and all, that is not there. We have to improve, increase, and then only we will be successful. The most important target people for me are the school children. We
Right,
have
I
to
was coming to that. But
yes,
before that, who is first responder in CPR?
whoever is there,
All right.
whoever is there who has seen the first person, whether is educated or not educated, or whether they are trained or not trained, don't bother. You just call for help 108. Then there is a possibility. Nowadays, we are insisting on 108 also to teach them CPR, telephone CPR. You instruct them what they do on telephone. So this, because some compression is better than no compression. Always there need not be an expert in doing a CPR available, but somebody who can compress the chest and make the oxygenation available is most essential. And let us start a telephone CPR, which will be the important.
Tell us about school children and CPR and what is the
Yes.
impact on them?
The school children and CPR, actually, we have approached the director of CBSE in Delhi, and they have included the most important thing is they have included the CPR in the ninth class syllabus. All our book is almost reproduced there in their curriculum, and then. But our unfortunate thing is they have included, and the COVID is rampant. Now we are recovering from COVID, and probably next month, probably I will be going to Delhi again, and we will be meeting the officials, and we will be making it compulsory. We should make it compulsory. Unless otherwise made compulsory, nobody will read or practice CPR in any of the place. Especially in India, we want some marks or something, somebody to watch us, then only we do. So this will be definitely will be picking up by next year. And already our people went and trained from since January. Our people are doing there. And what we want is we cannot train all the school children. We wanted to train the school teachers. So let the school teachers in turn train the school children. Because why we are concentrating on school children is the school children will be at home in the evening of home, and most of the cardiac arrests are occurring at home in the night itself. So let the school children will take care, and and what I observed is they are more interested in doing it, and they are doing it in a most perfect way than the adults. That's how we wanted that them as the target population to teach CPR.
Absolutely. Tell us about drone CPR as that is also in vogue these days. What is it? And
Yes,
also,
actually, drone is not started at in India. Actually, because I told you there is a lot of congestion of traffic for the AED to come or the ambulance to come. So the drone CPR has to be started. We have to, of course, we have a very close partnership with 108 and other people also. They are also a part of our faculty. And what we wanted to tell is if they are equipped with some drones, the AED can be sent uh, with a drone to the victim immediately without any hindrance to the traffic or anything. It can easily come and then delivered. And the important thing in AED is it will teach you how to apply shock and everything. So even of course for the first time it will be difficult, but even how to apply the pads, what to do, what we have to do during the analysis of the heart, and why we have to do, and it will decide the amount of joules of current that has to be given, and it will give the current. So that is the wonderful thing. Definitely, I hope that within an year or two, we will have a joule, a drone CPR can happen in India. We are progressing in a very good space nowadays. So this space will definitely, we will catch it up within 1 year, I feel.
Please define community access AED. You mentioned AED, Dr.
Yes,
Chakra. What is community access
yes.
AED?
The AEDs in European countries are kept in important places. Important place in, it means in malls, in railway stations or bus stations, or in the places, in the junctions where there is a lot of traffic and all. So that if something happens, even in your studio, I advise you to keep one AED. In my house, I have an AED. So we do not know, we do not predict when death lays his icy hand. We don't know. And these are the things. And actually, we have AEDs in almost all the airports in India. But the thing is, whenever I go into the airport, I'll go to the AED. I will ask them, the nearby shopkeepers, do you know what is this? Do you know what is CPR? And most of them, they don't know. I have written to those people who have provided the services of AED that please train the nearby shop owners about this. They should know what it is and how it has to be used, because somebody like me maybe searching for an AED, but there should be somebody who should be able to guide me to the nearest AED. And of course, in many of the floors of the many of the airports, there are AEDs. I've seen. I sometimes take the photographs and keep it for me because I'm very confident here. And even
Absolutely, doctor. One more very important question before I switch to anesthesia related issues is that when do you actually stop CPR? How do you know you need to stop? And what is IICOR?
yes, when should I stop CPR? When the patient is responding, when the patient, a victim is responding with verbalizing words or purposeful movements or coughing or vomiting, it is the response. Then we need not do a CPR. We have to turn it to the left side so that if there is anything, and he will be breathing properly without any obstruction, and it will be nice for him. And when the scene is unsafe, if there is a flood, the flood waters are coming, or the wildfire is coming towards us, or the spread of the poisonous gases is coming, we have to stop the CPR and go away from the place. So safer place. Another thing is when the patient has become stiff, already dead long back, there is no need for doing a CPR. And when you have exhausted, there is no help for you. And when you are doing the CPR, it is sometimes very difficult. You may be exhausted. Then you stop CPR. Take time. Of course, you should not stop CPR, but because there is no help, you have to save yourself. Otherwise, you will be succumbed to the problem. So those are the things. Then regarding the ILCOR or ILCOR, it is the International Liaison Committee for Resuscitation. So this is actually started in 1992 by the American Arts Association itself. And what this society will do is, there are only 6 countries involved in this, like Canada, America, South Africa, European Union, and some of the Asian countries like Singapore and Japan. And actually, unfortunately, India, with a population of 140 crores, do not have a membership there. So I am arguing with them. Actually, I have a meeting with them on next 17th of this month. They are inviting us now to become the members. So even the seven countries or six countries are not equal to the strength of India. So, if India is involved, we can make a very big research on this CPR because we have more victims. As I told you, 4,280 people per 1 lakh population every year. So we can have this. So this ILCAR means ILCOR. IL means disease, car means cardiac, heart. So they term like that also. But what that they are regularizing the CPR in all the countries. Not only that, they are regularizing even the ECG protocols in the world. So that is ILCAR, and probably we are getting our membership soon with all your wish.
Absolutely, Doctor. We're running out of time, and I'd like to end here, and we'll do the second round with you very soon. Where I'd like to reiterate to all our viewers that CPR is trying to make every citizen a lifesaver, and so that a layperson also can perform
Yes,
cardiopulmonary um,
resuscitation.
um, with both his hands, and it's even useful for the army personnel. In the end, I'd like to
Yes, yes,
thank
yes.
you, Dr. Siddharth Chakra Rao, for joining us and
Thank,
sparing your valuable
thank you very
time
much.
in educating us. And with this, friends, this is a wrap of this edition. We'll be back with more interesting episodes on Let's Talk Health. Till then,
Thank you very
uh,
much.
stay vaccinated and keep
October
your mask.
16th is the World Restart a Hot Day.
Yes,
We are doing a wonderful work for the last 3-4 years, and probably we will we like to have a
we'd like
chance
to
to
congratulate you
interact with the
from
people.
all the
Thank you.
team at India Science. Thank you so much. Thank you for
Thank you.
watching, viewers. Namaskar.